Hello, I'm Mary Burguieres. I'm Lead Manager for Policy and Strategic Partnerships at Surrey County Council. Information sharing is fundamental to public service reform. Public service reform is not about getting better and better at delivering single services. To a great extent, public services have done that already. Public service reform requires whole system change, and change that's about delivering fundamentally differently and holistically around better outcomes for people and communities. So what does that require? Certainly no one service can do that alone. What I've found through working in Surrey and with colleagues now in Sussex as part of our devolution ambitions is that we need to use our information and our data collectively across public services to understand the complexity of the needs of people and the interrelationship between those needs. So we're working with police colleagues, we're working with districts and boroughs, from my standpoint of view of being at the county council. We're working with our mental health providers, we're working with our CCGs, we're working with our ambulance service to understand how service users come into contact with our services individually, often, the episodes that bring them into contact with us, what outcomes they get, and where we could work better to respond earlier and in a more preventative way that will help improve their lives. I'll give you some examples of how we've begun to use data and information sharing about service users in a much more whole systems way. We've recently in Surrey launched 5 new safe havens. These are places where people in mental health crisis can come and find support, both from peers, so other service users, people who themselves have experienced mental health crisis, but also mental health professionals. We also provide in those places access to information about whether employment or other types of services that may also meet their needs. But they're an alternative to going where we know many people have gone to A&E or calling the police, 2 least good places for them to go. So through our information sharing with our acute hospitals, with our police, with our mental health provider, and with our third sector, we really understood the experiences of people in mental health crisis. We shared that data through our crisis concordat, we looked at it, and we thought about a different response. So the safe havens are our alternative. They're our whole systems response. They're not provided by one service, they're provided by a multi-agency partnership. We know the data is still early, that we're capturing through the experience of people going to the safe havens, but we know that they are using them as an alternative to going to accident and emergency. So already we're having an impact on people's lives, and already we're having an impact upon acute services that are costly and where demand is spiraling. So I think that's an example of how you can use information collectively, so that gathering data together, analyze it and think about alternatives. So that's the change, that's the transformation, and then continue to collect data to tell you about the impact on individuals, but also the impact in terms of better outcomes for our services. Obviously, within that setting of a safe haven, we as local leaders had to come to a common agreement about how we would share the information that patients, that service users were providing in safe haven settings. So we agreed to some common protocols in terms of what's confidential to the patient and to the practitioner, what can be shared more widely, what we would expect from, let's say, an ambulance that might bring someone to a safe haven rather than to accident and emergency, what they would be providing in the handover. So a whole layer of complexity in terms of information and data sharing, but it's really all about that person who previously would have had possibly quite a rough experience at a very difficult time of their life.